Hi everybody, Abby Bell here, CEO of Independence Fits You, and I wanted to take a few moments to go over another idea I had for one of my case study exams. This is for Phillip. He is the 35-year-old male with autism. He does have good communication skills, however, he does require supervision for higher level activities such as money management, medication management, planning, things along those lines. So medication management, for example, is something that I do a lot as an occupational therapist. And Philip's primary goal is to live independently and eventually start a family. So I wanted to take the time to go over a few treatments that have worked for my clients in the past, because we have a variety of things that can be beneficial for consumers. So this, I'm sure most of you have seen, this is your typical pill box. You've got AM boxes and PM boxes. So depending on Philip's needs, he may need assistance once a week filling this up. But maybe it's more that he just forgets to take his medications twice a day, which again are going to be very important because I would assume that some of his medications help to manage those difficult behaviors. So it's really imperative that he does remember to take his pills. So, we could pair this with a timer, with a daily checklist. There are a number of ways to help him give a little cue to tell him, hey, it's time to take those medications. If he gets confused as to what he's taking, why he's taking it, when he's supposed to take it, I really like this My Medicine record. I'm not sure how well you'll be able to see it. This just really gives people an idea of what these medications are for. So it's the name of the medication, what it looks like. I really, really like that because obviously we know the pills can all look very similar. So that's a helpful way of keeping it straight so that you're not accidentally taking the wrong thing. How much you're supposed to take, when to use it, when to start it and stop it, what it's for. Obviously, that's a good thing to know. And then who prescribed it. So I like that as well because a lot of these consumers will have different doctors. And so if they do have an issue with a medication, it's easy to find. This makes it much easier to say, oh, that was Dr. Smith, I'm going to give him a call, because it also leaves a little spot to put their phone number, so that eliminates some steps. And then the last thing I wanted to show you is an automatic pill dispenser. Again, a lot of you probably have seen these before. So if Philip really does struggle with medication management, this is something we could always start with just to make sure, ensure that he's taking the right things at the right time. And then we could downgrade it, or it might prove to just be really beneficial for him and he can keep it. So what I like about this is when it's time for him to take a medication, it will give an auditory reminder. It'll say it is time to take your pills, and it will dispense exactly what he's supposed to take at the correct time. I really like that. It has a lock to it, so he wouldn't be able to get into it if that's something that was of a concern. Obviously, there would have to be someone else that needs to fill this up, but they're all different. Some need to be filled up on a weekly basis, some on a monthly basis, but again, that would make him a lot more independent than having to have someone there every morning and every night saying, hey Philip, it's time to take your medication. So again, these are just a few of the things that have worked, have been successful with my clients in the past, and that I would certainly incorporate with consumers such as Philip in the future. But the list is pretty much endless. So wanted to give you a little taste there. Thanks so much.